Hi, and welcome to Milestone Pediatric Therapy's Motor Minute. I'm McIntyre, and I will be the host of Motor Minute. I'm a pediatric physical therapist and owner of Milestone Pediatric Therapy. Motor Minute is a segment that will be going over gross motor skills of a developing infant. My co-host here is Harriet. She's currently 7 days old in the neonatal stage of motor development. The neonatal stage lasts 7 to 10 days. In this stage, they are predominated by random movements and reflexes to external stimuli. You'll notice that she keeps her limbs in a flexed position, mimicking that of of the position she was in while she was in her mother's uterus and she was developing. All right, Hattie, you ready to show them off your skills? So we'll be starting off in a supine position or laying on her back. You will notice that she will present with some farting and some random leg and arm movements. These movements are typically fairly random or maybe brought on by some external stimuli such as touching her feet. You'll also notice that head movements are typically precipitated by her rooting reflex or a high contrast image. Right now she's fixed on some brightly colored things on the other side of the room. All right, I'm going to move Hattie, oh, there we are, into sitting. All right, so I'm going to put her in sitting. You're going to see that flex position continue. Oh, there we go. It's okay, baby girl. She doesn't have that strength yet to lift her head against gravity, but she might try. Won't be able to hold it for very long. And she most certainly can't sustain this position without an adult in attendance and helping her be supported here. All right, I'm going to place her onto her belly, which might make her mad. She's going to resume that flex position. Knees are going to be tucked underneath of her body, and her head's going to be turned to one side with elbows back behind her shoulders. In this position, she may try to lift her head, but it's going to take a whole lot of effort, and she's not going to be quite able to turn it the entire way. She might take several attempts to get it to turn, but again, we're pretty fixated on our high contrast images here. And this position, especially even as she ages, being reclined on a chest or over a boppy pillow is a great way to help support this position and encourage her to be here. Tummy time for play is an extremely important thing in a child's development. All right, Hattie, you ready? We're going to try standing. You are just loving those pictures. All right. So in standing, an infant at this age may present with a positive reaction or a stepping reflex. Oh, there's a little positive. She'll try to support her own weight and or take some walking steps. Again, these are just reflexes to her feet being placed on the ground, and will integrate or go away within 2 to 6 months. Alrighty. Infants at this age are typically highly engaged in high contrast color, black and white photos, or with their parents' faces, but remember, they can only see about 8 to 9 inches in front of their face, so keep images close for them to be able to enjoy. All right. Thanks for joining me on Motor Minute. Next time we'll learn about the 1-month gross motor milestones. Any comments or questions, please leave them below and I will get back to you.